Intraocular injections are one of the most common procedures we perform in the office. There are many reasons why a patient may need an intraocular injection. The most common reasons would be for wet macular degeneration, also known as exudative macular degeneration, swelling of the retina related to diabetic retinopathy, also known as diabetic macular edema, swelling of the retina related to a blocked vein, also known as a vein occlusion. But there are many other reasons why patients might need these medications in order to dry out the retina. The medications that we primarily use are Avastin, Lucentis, and Eylea. All these medications work in a way to remove fluid from the retina. When the retina is swollen like a sponge and has fluid in it, it doesn't function as well, and as a result, people don't see as well. The medications work by blocking a molecule in the eye that causes the retina to become swollen. This molecule is known as VEGF, or vascular endothelial growth factor. The medications are actually antibodies to this molecule, which causes problems inside people's eye, including swelling of the retina. When we first recommend an intraocular injection, we understand there might be some initial dread or fear from the patient regarding having this procedure. We're very sensitive to this. It's very important that the patient is completely comfortable during the procedure and does not feel any pain. The way that we accomplish this is by numbing up the eye prior to the procedure. Initially, what we will do is place 1 or 2 drops of a numbing solution inside of the eye. Oftentimes, we'll place a sterile gauze pad that's been soaked in the numbing solution in the corner of the eye and allow that to sit for 5 minutes or so. Oftentimes after that, we'll place some additional numbing solution next to the eye. The procedure itself only takes a moment. What we will first do is place a speculum inside the eye that holds the eye open during the procedure. After that, we typically will instill 1 drop of a disinfectant solution known as betadine, followed by the injection, and then removal of the speculum. At the end of the procedure, we typically will rinse out the eye to make sure that the eye is completely comfortable. After an intraocular injection, it's not uncommon that a patient may experience mild floaters or a black dot in their vision. These typically go away within 24 hours. In some cases, patients may experience mild stinging or burning that we typically treat with over-the-counter artificial tears or cool compresses. If patients notice additional discomfort after the injection, some may use over-the-counter pain relievers. The risks of an intraocular injection are very low. However, it's important to be aware of them. Risks of an intraocular injection include some mild bleeding around the eye, risk of infection, or a risk of retinal detachment. It's important to understand that these injections oftentimes take time to work, and they don't work immediately. So it's important to be patient. If a patient experiences any problems after the injection, it's important that they call our office immediately. Problems after the injection would be if the vision gets worse, or if they notice a dark curtain in any section of their vision. Our offices are available at any time to be called, and we will provide you any support that we can.